Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about alternative jobs that I do recommend for brand new medical coders. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, this video also pertains to people who are interested in getting into the medical coding field, but they've heard that maybe, it's a little harder to get a job when you're first starting because everybody wants experience. But you really kind of want to get in and see if you can get experience before you go through the school and things like that. These are some good alternative positions to start that will get you some filler for your resume. It will get you those transferable skills because, as I said in the previous video, time is very precious. And a lot of people are just not using their time wisely. When you are just fresh out of school, you want to get into positions that are going to apply your knowledge as a medical coder. But a lot of people will get discouraged in the beginning because everybody wants experience and they're still not applying. Even after I've told you guys to apply anyway. It does not matter if they're asking for 3 to 5 years experience, 1 year of experience. You still need to apply. If it is for a medical coding position, you need to apply anyway, okay? It doesn't need to say entry level. It doesn't need to even have your credential listed. As long as you have a really good resume and you put yourself out there, there's a lot higher chance for you to get called for those positions rather than just seeing that everybody is looking for experience and then just giving up and getting mad, okay? So don't do that, guys. And these positions today are good foot in the door positions. These are very good foot in the door positions. These are going to get you that transferable skill for your resume. It's going to get you those connections that you can make in the industry, because sometimes people will use these positions as a stepping stone to get their foot in the door in a facility, for example, and then just be able to transfer over when they hear there's an opening in the medical coding department. Okay, so these are the ones that I do recommend. The first one that I do recommend is a prior authorizations specialist. Now, according to Google, this is what a prior authorization specialist does. This position is responsible for obtaining pre-certifications and pre-authorizations for procedures and medications, scheduling appointments for outpatient testing and other providers, with other providers, transcribing and triages patient calls to physicians, coordinates patient appointments and orders. So there's a lot of variety of tasks that you do as a prior authorization specialist. But the most important task that you want to be able to highlight if you get this type of position is the fact that you are going to be looking at this documentation. You're going to be told by the provider, hey, I want to do this procedure on this patient who has this condition, call the insurance company and get the pre-authorization. Then you let the insurance company know by looking through the documentation and making sure that it does support the provider's request for this procedure. And so that has a lot to do with, now you got to look at diagnoses and you got to look at procedures. Transferable for your resume, okay? Transferable for your resume. And so having that knowledge right there off the top of your head, I mean, as far as like looking at it and getting into it, prior authorizations is a great and wonderful position to start in. So that is something that you can consider as long as you're applying out there for medical coding jobs as well, and you really want to get into a job, you can apply for this. And the same thing for people who are not quite certified yet. Some people have told me, hey Blue, can I still apply for positions even though I'm still in school? Absolutely. And this is one of those ones that it's not really going to require a medical coding certification either, okay? There's a lot of positions for prior authorizations that do not require a medical coding certification. They would love it if you have medical terminology and anatomy already. Again, that's part of your training. So this is a position you can definitely apply for, whether you are finished with school or whether you are not finished with school yet. So this is something that you can keep on your radar as one of those alternatives, okay? And the other position that I would recommend would be charge entry specialist. So sometimes they'll call them data entry specialist, but a lot of times it's called charge entry specialist. I looked up the job listing, and these are some of the duties that a charge entry specialist does have. So in this role, you'll receive and review charge documents for accuracy and coordinates with the front office staff on all payment and billing issues. You will enter charges into practice management system. You will balance charge summary to tickets keyed before finalizing / updating charges in the system. You will extract information from medical records, operative notes, hospital admissions, consults, progress notes, and discharges to ensure completeness and accuracy. You will assist with identifying quality issues with registration and scheduling activities. So there's, again, a lot of different tasks, but great for transferable medical coding skills, right? So that's something that you need to think about here. Now, a lot of times when you're entering this stuff in, obviously, you're going to be using the electronic medical record, right? And so that's going to give you a transferable skill right there, because it's important to have this electronic medical record training. If you don't, it's okay. No need to panic. That's usually where employers are willing to do training when you are first brand new. It doesn't matter if you have no experience or you have experience. They're always willing to train on their electronic medical record system, because not everybody uses the same electronic medical record system. Now, guess what? You also have that to add to your skills list. Whatever electronic medical record that they used in this data entry position, whether it's Clinical Works or Epic or any of those things, you can use that and put that on your resume. So that's another good skill that you can get there. Now, this is going to require you to look at documentation and key this stuff in. Obviously, there may be some things that pop up, like there's an error or something that's coming up that's not letting this thing go through, and it's on you to troubleshoot it, and you will learn more about that in that position. But again, it's a really good place to get your feet in the door somewhere, because then you're going to, if you are a certified medical coder, or even if you are still a student, you're going to understand the application of modifiers. You're going to understand the procedures. You're going to understand the diagnosis codes. Like when it's a pediatric diagnosis on an adult patient, you know that that's not going to go, right? Or a neonatal diagnosis on an adult patient, you know that doesn't go. So that's something that you can bring to this type of position. Now, this is going to be a lot of data entry, so it's going to be a lot of typing. So you have to be up on your typing game. You have to know how to use the 10 key by touch. And before you look at me like I got 3 heads, 10 key by touch. On your keyboard, there's like a section, like a little pad that has all your numbers on it, right? At least a lot of the computers that I've worked with still have that on there. But you have the little keypad. It's got the number 5 in the middle, and it's got the little, it's got like a little divot on it where you can use that as your starting point for all your numbers. And it's really good to have that skill. I have that skill. A lot of people have that skill, but some people don't know what it is. That's 10 key by touch. When you can do the numbers like that, that's 10 key by touch, okay? But you have to have really good typing skills. You have to have a very sharp eye for detail. Again, something that is critical for medical coders. So, you know, with the charge entry, there's going to be a lot of other duties that you're going to have as assigned, right? Like as far as like working with the front desk staff and, you know, all of those things. But again, it's filler for your resume. It's a good position to start in. This is something that can be an alternative for you, whether you have any certification or not, okay? They don't require certifications for this type of position, so that's something that's good if you don't have your certification yet. But they do say that knowledge of medical terminology and coding is highly preferred. So preferred, the word preferred, whenever you see it in a job listing, the word preferred does not mean required, okay? That's very important to know. Now, yes, a lot of times they'll say, oh, 3 to 5 years required. Ignore that part, okay? If it's for a medical coding position, apply anyway. Apply anyway. But when it comes to your skills, look, they say knowledge of medical terminology and coding is highly preferred. Preferred does not mean required. But if you are in a program or if you're just recently finished, again, that's another skill that you can tell them, hey, I have this skill, you know, and this can edge you out against other people who don't have this skill, okay? And then they talk about like familiarity with third-party billing requirements and payment policies is also highly preferred. So if you don't have that, it's not necessary because you're going to learn it on the job. And that's something that there's going to be things that you are going to learn on the job. But it's up to you to apply at these places, okay? And again, keep in mind, we don't talk about salary and specifics, but when you apply for these alternative positions, they're not going to pay the same as a medical coder, all right? So if you have your heart set on a certain figure or whatever, make sure that your figure that you're having your heart set on is actually correct and not some high, ridiculously high number that these schools try to sell, okay? Make sure that you look at the Department of Labor or the Bureau of Statistics for a medical coder to see what they make in your area, because it's different everywhere, okay? So that way you can have a realistic expectation of what you should expect when you do start to work as a medical coder, okay? The other position is medical billing. This is a great place for new medical coders to start. You don't have to be certified to be a medical biller. They will often train you on the job, but if you have this medical coding training, that's really great, because then you're going to understand why things get denied or why claims got rejected or for whatever reason, because you have that trained eye as a medical coder. You know why these denials could be, why they would have these edits come up, right? You're going to understand that, because as a certified medical coder, that's something that you're tested on and that you know, right? So that's something that can help you to have transferable skills for a medical coding position. A lot of medical coders start their careers in medical billing. And so it's great because you're coming with that side of the house knowledge about the insurance company, and now you're going over into just like the reading part and abstracting all of the diagnoses and the procedures. See, I say abstract, that listing says extract. Yeah, that was a little weird for me. So, but anyway, that's something that you should also consider. Medical billing is a great place to start, but you will be working with customers, you will be working with the patients, rather, and getting money from them, or calling them if there's a bill, or letting them know what their balance is. And so it does take somebody with really good customer service skills to work in that type of position as well. But it's going to give you more to put on your resume as far as having that time into the field already that you can build on. You know, medical billing is a great place to build on. I do recommend that if you're going to be interested in a medical billing position, some people will hear about that they heard that they can have their own business as a medical biller. Yes, you can. However, I will always recommend that you work under somebody first, that you're not just going to finish your school program and then immediately try to go into a medical billing business. I don't think that's good at all either. You need to have experience for something like that, because now you're messing with not just the patient's money, but the provider's money as well. And if you don't know what you're doing and you're trying to take all of this on, you know, you could potentially affect a lot of people. So you want to make sure that you know what you're doing before you start having your own medical billing business, all right? And that is something else completely different. That is out of my wheelhouse. But that's just something that I want people to know. Some people have said, oh, I want to do that. And, you know, I want to do that. They have these grand dreams and ideas of what that would be like. It's a lot of responsibility to have your own business, folks. Let alone a medical billing business at that, okay? So just something to think about, all right? But just make sure that you get that experience. If that's the medical billing path is the path that you want to go down, make sure that you do all of your research if you're trying to have your own business. But I do, again, honestly recommend that you work under somebody first and get to learn all of the processes and what it's actually like before you start investing even more of yourself into this business, okay? And the last position that I want to share that I think would be a good place to get your foot in the door, release of information. Now, why is release of information a good place to start in? Okay, release of information does require you to have HIPAA training, right? And because a part of all medical billing and coding programs, you are going to be talking about HIPAA. That is your HIPAA training. Now, HIPAA. Release of information, or ROI, they call it sometimes. ROI, release of information, they are going to expect you to be very detail oriented. You are going to get requests from patients and sometimes from their advocates, like their attorneys or, their caretakers and things like that for their medical record information. And it is your job to make sure that any of the medical information that you are releasing is going to the correct person, that they have the right to have this information, okay? This is not something that you can just dish out willy-nilly, all right? But it will get you in the door to a facility, and having that experience, it will get you around the people who do the hiring for like the medical coders. So again, that's something that you can transfer over. Those are transferable skills that you have with release of information. Working with those medical records, also, you're going to be working with the electronic medical record. So that's something that you can also put down in addition to, you're working with paper records as well, because some people are still working with paper records, okay? So sometimes that does happen. But again, having these skills you can transfer over when you apply for these medical coding positions. And if you are working in a hospital or whatever, and you see that there's an opening for a medical coding position, that's something that that, hey, I'm already in. And they're going to look at people who are in-house first, because it is a lot easier to transfer in-house than it is to hire somebody who's from the outside, okay? So if you can manage to do that, that is great. That's a great way to be there. But it's also going to get you around that part, so that you understand, hey, this is what happens when they are requesting their records and things like that. So you're going to see those records. You're going to be able to know that you have that confidentiality on your resume as a skill as well, because again, you're always having to exercise HIPAA in those instances, and that's something that you can have. So if you have to really kind of open your eyes to these alternative positions that are out there. For medical coders. And keep in mind that with medical coding, they're going to be named all kinds of weird, funky names too. Sometimes they're also called medical records tech. Sometimes they're health information technicians. Sometimes they're called revenue cycle techs. That's something that's weird, because I think revenue cycle, I think of billing. But I have seen some job listings where they are listing the person, a medical coding position, as a revenue cycle technician. So again, it does take you to look under these alternative names for these positions. But these are all the positions that like I said, they're going to give you those transferable skills if you are brand new to the field of medical coding, or if you're interested in becoming a medical coder and you want to see about getting a job first. These are some things that you can apply for. Charge entry specialist, prior authorization specialist, medical billing specialist, and release of information, or ROI, okay? These are all those 4 that I recommend. And it's a great start. It's a great start. It'll get you going. And again, it'll make those connections. I was going to say contacts and connections at the same time. But it'll get you those connections so that you can get your foot in the door. It is possible, guys. I would love to start seeing people say, oh yes, Bleu, I applied for all these positions even though they're asking for experience, and I've been getting calls back because I have a better resume now, because I followed the advice and I updated my skills, and I took off those qualifying words like excellent, ICD-10, CM, diagnosis, looking up. They don't need to know all that. If it's on your skills and you say ICD-10, CM, that's perfect. If you have ICD-10 PCS training and you put ICD-10 PCS without having to qualify it, ICD-10 PCS, perfect. CPT 4, because we're on the 4th edition of CPT, that's perfect. Or even if you put CPT, that's fine too. But if you look in the job listings, a lot of times they'll say CPT-4. It just means 4th edition. 4th edition. It is the same CPT that we are all using right now, okay? If you have HCPCS training, HCPCS knowledge of the book, HCPCS level 2, all right? That's what you need there. Medical terminology, anatomy, pathophysiology, those are all very important skills that you've got to have on there. I'm just saying. So Best of luck to you all out there. If you're looking for a resume rewrite, my rate is in the description box below. There's a ton of resume writers also on LinkedIn. So you have options. You have your choice out there. So best of luck to you. Stick with it. You will find your job. Continue to study. Continue to study, because if you stop studying from the time that you've passed your certification and you're out there looking, and 1 month turns into 2 months, turns into 6 months, you're going to start forgetting, and you don't want to forget, because they will give you a proficiency test when you are applying for medical coding positions. I'm just saying. So make sure you're still studying. All right. I will see you guys later. Like, subscribe, and share. Bye.